Hello, I am Dr. Sibia. We bring to you today news about a new therapy known as cytotron therapy. Cytotron, the power to regenerate tissue. Cytotron is an equipment with which the cartilage of the joints can be regenerated, and it brings hope to millions of patients around the world to help them walk again comfortably without pain. Osteoarthritis of the knee is the commonest joint disease, and it affects 1 out of 8 adults. Osteoarthritis means inflammation of the joint and is caused by wearing out of the cartilage. Patients feel pain, stiffness, grating sensation, loss of mobility, swelling, and deformity in the joint. Tests such as X-ray, MRI, and CT scan confirm the diagnosis, whereas dynamometry and gynometry tell us the extent of the disease. And now we have a new treatment, cytotron therapy. Cytotron produces high-powered electromagnetic resonating beams that help regenerate and repair the cartilage, relieving pain and disability and enabling the patients to walk again comfortably. The principle of cytotron is very simple. Throughout life, cells die and are replaced. With age, cells replaced are less than the cells which die. This leads to decreased cartilage mass. Cytotron increases the cell growth rate, hence reverses the osteoarthritis. Cytotron is a very patient-friendly treatment. The patient lies on the cytotron bed. Bed goes inside the gantry and the beam is focused onto the knee. The computer calculates and applies the dose. The treatment duration is for 30 to 60 minutes a day for 21 days. The patient feels no pain or discomfort during the treatment. The success rate is reasonable. Most patients show improvement, 70% good, 20% fair, and only 10% patients fare badly. There is no harm to the patient whatsoever. Patients know that they are better because they feel better and they test better. They have decreased deformity, pain relief, can walk more, many can squat on the floor or climb stairs which they could not do earlier. X-ray and MRI show growth in the cartilage. Dynamometry and goniometry show improved joint function. There is better joint stability and improved alignment. The knee score is better. This is the comparison of the pre and the post-treatment X-rays. The arrow marks clearly show the development of the cartilage. This is another X-ray showing improvement. Hundreds of media have given excellent coverage about cytotron therapy. Some have called it miracle cure for osteoarthritis, a revolutionary non-invasive method for treating osteoarthritis and cancer. Patients are now without pain, can walk normally, climb stairs without help. The Tribune writes, most of them reporting improvement in walking, stability, and considerable reduction in pain. This itself would be a big boon to many women suffering from this debilitating affliction. While Sainik Samachar writes, almost all patients were able to walk for 1 to 5 kilometers without pain, and 16 of the 36 could squat on the floor, which they could not do earlier. Newsweek International calls it something less than a miracle. Another leading Indian newspaper, The Hindu, writes, it's a boon for cancer and osteoarthritis patients. After being treated with RFQMR, all the patients experienced pain relief in just 5 exposures and could walk for some distance. He could not get out of bed a few weeks ago. Now he can drive his car and walk a lot. Another media writes, all conventional modalities of treatment had proved unsuccessful. The only other alternative of surgery remained. Almost all of them could walk for 1 to 5 kilometers without pain after the treatment. In Current Science, a patient gives his experience. I have myself undergone the RFQMR treatment for osteoarthritis. I was unable to walk even a few steps. I took the RFQMR therapy. Today, I am able to walk 2 to 3 kilometers at a stretch without any discomfort. Coffeeland News writes, it's a boon for osteoarthritis and cancer patients. In the case of osteoarthritis, the beams are focused on the affected spot, hence initiating signals to regenerate the cartilage tissue. The Journal of the Indian Society of Aerospace Medicine writes that it stimulates the chondrocytes. There was high significant improvement in pain score, total knee score, total functional score, range of movement, and force of extension. The Living Media reports that it's a technology to banish those wincing pains. While a knee score of 25 after conventional knee surgery is considered a success, the team at the Institute of Aerospace Medicine recorded a knee score of 50 and above in patients they treated. The Times of India editorial writes that if the RFQMR technique turns out to be as good as its initial promise, India could certainly find itself in the forefront of cancer management. The Week magazine has given coverage to cytotron therapy as news you can use. We at Sibia Medical Centre believe what the President of India, Dr. Abdul Kalam, has said. The ideal practice should be to provide only the minimum essential treatment instead of going in for surgical intervention as a routine management of the disease. Cytotron is for anyone who has early osteoarthritis so it never reaches the advanced stage, or for those who have advanced osteoarthritis who are unfit for joint replacement, who do not want to have surgery or who cannot afford surgery. Being safe, it can be tried for all before thinking of knee replacement. What is there to lose? Even if it is unsuccessful, joint replacement can still be done. We believe that surgery should be preserved for patients with crippling disease who do not respond to more conservative treatments. We should think of surgery only when all other safer and less traumatic treatments fail. We make cytotron available for patients of osteoarthritis and of cancer. And in the service of humanity, we invite anyone interested in the treatment to contact us. We are based in Ludhiana in India and can be contacted at mobile 0091 98140 34818, or you can email us at info@sssibia.com, or go to our website www.knokneesurgery.com or www.sssibia.com. Thank you for being with us, and bye.